This is a video about how to obtain lactation-specific clinical experience, and we're going to review the 3 IBLCE pathways. My name is Dixie Wetzel. I'm the primary instructor for the lactation education courses at the OHSU-PSU School of Public Health, where we offer an undergraduate certificate in human lactation. So, out of the 4 steps for certification, we're going to focus on obtaining clinical experience. IBLCE has designated 3 pathways for obtaining clinical experience because folks come from many different backgrounds to become lactation consultants. Each pathway requires a different number of hours of experience and a specific type of supervision. It ranges from 300 to 1,000 hours of experience. You must complete all of that within the 5 years prior to taking the IBLCE exam. What counts as lactation-specific experience? Assistance to pregnant and breastfeeding families, education to families and professionals. This can be done in a paid or volunteer capacity, and again, it's time sensitive. Pathway 1 requires 1,000 hours. This is typically used by recognized health professionals and breastfeeding peer counselors who can actually obtain their clinical experience while they're working or volunteering. You must be supervised in this pathway. However, your supervisor does not have to be an IBCLC, and the lactation education that's required for every pathway, in this pathway it can either be continuing education courses or college credit courses. There are a variety of health professionals who might use this particular pathway. This is a listing that's on the IBLCE website. They also, IBLCE has recognized a variety of peer counselor organizations that meet their standards, and so you can go to their website and look at that listing. Here in the United States, we have Breastfeeding USA, which is one of many different peer counselor groups, but that's a national group. You can become a peer counselor with them regardless of where you live in the United States. Here's the rest of the list. We also have La Leche League groups here in Portland, throughout the U.S. and throughout the world, and that's just another example of breastfeeding peer counselors. So peer counselors, IBLCE is changing how they count the actual hours of experience for peer counselors. So heads up, until January the 1st, 2022, they will give credit to those peer counselors who primarily do in-person work. They'll give them credit for 500 hours per year of service. If you primarily just do phone or texting or email advice, you get 250 hours per full year of service and credit for that. After January 1st, 2022, that will no longer apply, and peer counselors will get credit per hour of service that they provide. So heads up on that change that's coming up. What do we offer for Pathway 1? If you need the health sciences education courses because you're not a recognized health professional, we provide those, and we provide 100 hours of your lactation-specific education. Pathway 2 then would be it requires 300 hours and is for students who are admitted to academic college credit programs. In this pathway, you will be directly supervised by IBCLCs for all your clinical experience, and your lactation education must be college credit courses. What do we offer? We offer, again, the health sciences education courses. If you're not a recognized health professional, 100 hours of lactation-specific education, and we offer a Pathway 2 Lactation Practicum that is a limited entry part of our program that you must be admitted to. For Pathway 3, it requires 500 hours, and this would be for students who are working with an IBCLC mentor who has agreed to provide them with direct supervision for 500 hours. You must have your mentorship contract with your mentor completed and approved by IBLCE before you can do that, and there's a cost for that application and contract being approved. And again, if you look down at the lactation education, your lactation education can either be continuing education courses or college credit courses. For Pathway 3, we offer, if you need it, the health sciences education courses and 100 hours of lactation-specific education. In Pathway 3, students must find their own mentor. We don't provide that service in our program. There is a listing of clinical instructors on the ILCA website and of mentors, and those are the same thing, on the USLCA website. So you can check those websites to see if you're looking for a mentor. Just a review of kind of the steps in the process. First, are you a recognized health professional? If you're not, you must complete the health sciences education requirements. You must obtain your 90 hours of lactation education. You must obtain your supervised clinical experience and pick one of these pathways that provides the opportunity that you have available for your situation. So let's just review overall all the services that we provide. Those health sciences education courses, our lactation education. We have a limited entry pathway to Lactation Practicum. We provide lots of different ways to finance your education. All of our courses can count toward a BA or a BS in health studies, and we offer advanced degrees through our School of Public Health and other student services. If you still have questions about the different steps in the certification process, watch some of our other short videos, and that may help you out. If you need more individual guidance, you can email us with questions at lactation@pdx.edu. You can come in for in-person advising if you're here locally. You can talk with us on the phone or drop in for virtual advising as well. Here's our contact information for our program, and of course you can find out more information about becoming a lactation consultant through IBLCE.org or the International Lactation Consultant Association. Thanks so much for listening to this video, and good luck on your lactation journey.